Hey doctor, Dr. James R Fedich here. I'm the author of Secrets of $1 Million Practice, Proven Tactics to Grow Your Practice, and more recently author of Secrets of the World's Top Chiropractors. This is actually a transcript of my best interviews on my best rated podcast on iTunes, Path to Success with Dr. J. I've interviewed some of the greatest in professions, Dr. John DeMartini, Noel Lloyd, Lee Newman, Jay Morgan, everybody out there, Ed Osborne, Tristan from Chiro Sushi, you name them, they've been on the show, and the best of the best are in my latest book. So check that out. But today I want to talk about reevaluation and re-reporting. So it's one of those visits that doesn't get talked about in chiropractic as much. We love to talk about day 1 and day 2, and we often forget about the reeval. One of the most important visits in your office is the 12-visit reevaluation visit. So this visit often gets skipped, you get busy, gets skipped. Even in my clinic, it's something we struggle with every day, making sure we're doing these, and it often does get skipped. So we need to schedule that 12th visit reeval. The first way to do this is you're scheduling out the first 12 visits of care and you're already pre-scheduling that reeval. That's the real way to do it and have it pre-scheduled. If not, the 10th, 11th visit, you're letting them know and you're scheduling it, letting them know they block some time. Now, how you do the reevaluation and re-report is based on your practice. So there's a lot of gurus teach a lot of different things in there, and I've changed it in my practice as we've grown and things have changed over the years. So in a traditional one doc, you're not super busy, less than 200 visits a week. We're going to recommend a separate visit for reevaluation and re-report. So on the reevaluation visit, you're going to do the testing, etc., a regular office visit, discharge them, and the next visit you're going to do a re-report where you actually go over the information. So reevaluation and re-report are two different things. So in that kind of situation, a lot of offices are going to do it that way. In an ideal situation, you're going to do it that way. Again, they're going to come in. There's probably going to be some paperwork you're going to need them to fill out. You're going to do the paperwork. We're going to do the reevaluation, whatever that consists in your clinic. In my office, it's blood pressure, pulse ox, all that kind of vitals that we have to do. And mostly we use our MyoVision for our reevaluation procedure. So I'm a big fan of MyoVision, SEMG. We also use a posture program on our Apple posture program that's going to compare the posture before and after. So we'll have the staff do the MyoVision and the posture scan. And then if you're done there, they're going to be discharged. Say, all right, you're going to go get your adjustment today. Dr. Smith is going to go over with you on your next visit. So that'll keep those 2 visits just adding a little bit extra time. If you're re-x-raying, you're going to do that. If you're just doing range of motion, report of findings, whatever, if you want to do the range of motion on that visit, those types of tests we'll do on that visit as well. And the next visit, you're going to have that all prepared and you're going to go over with them. One key tip for that is to have it go over the reevaluation before they get adjusted. So what will happen in a lot of clinics is, here's your reevaluation visit, they're going to go back, get adjusted, do the therapies, whatever they're doing, and they're going to be out the door and you're not going to get a chance to go over it with them. So if you're doing a split visit, go over the test results first and then get them adjusted. So our 10th thing is we're busy, running back, just come back, let's get you adjusted, and we skipped going over it. So we've all been there, I've been there myself. So what you want to do is have them go over with you. If they got to wait in the waiting room for a couple minutes, or you need a special time scheduled, a little extra time, we'll block a little extra time in one of our examination rooms for them to go over it with them. So make sure you do it first and then treat it. Now, if you're getting busier or there's sort of certain restrictions, we can combine this into one visit, and that's what we're at with the 3 chiropractors. So we'll come in, they'll do the paperwork, they're going to do their scans, posture, all that stuff. My staff have prepared, and the doctor goes in, goes over it with them. We do it all in one visit and discharge to an adjustment. Most of you can do it in 2 visits, and that's a little more advanced doing it. Now, the exact details, the scripting that we go through, we don't have time to in this short video, but what's most important for the patient to know, am I doing, and this isn't what you're thinking. They want to know, are they better, how much better? That's a little bit, but what I really want to tell them, are you doing as well as I'd expect, better than I expect, or worse than I expect? The patients really like that. They're feeling like they're a little better, but they're feeling maybe not as much, and you tell them, listen, this is right where I expect you to be at this point in your care. They feel a lot better, and that's often the case clinically as well. They're 50, 60% better after 12 visits. Maybe they got a huge disc herniation. They're 60, 70% better after 12 visits. You're happy with them. So, to be honest with you, you're better than I expected at this point in your care. They're happy to hear that, even though in their head they've been disappointed. I wish I was 90, 95% better. But they hear, this is right where I expect you, or you're doing better than I expected. Or if it's a simple case in 12 visits, you expect them to be feeling a lot better than they are, and they're not. You say, listen, this isn't quite as good as I expected at this point. You're a little slower than I expected. We need to change our treatment program, or we need to do imaging, etc. And that's kind of what I tell my associates. If it's not working, do something different. If you tell me, it's not working, let's stick with it for another 4 weeks. You lose a lot of people at that point. If it's a few that don't respond well to regular chiropractic, do something different. Change your treatment plan in the office. Or again, imaging, if you haven't done imaging, that's always a great thing to say, you know what, this back isn't getting better as well as I expected. I think it's time to do an MRI just to make sure we're not missing something. Something like that. So really, that's the key. And again, we have the scripting in our program, but are they better than you expect, same, or worse? That's what they want to know. And again, if you start just right where I expect to be after 12 visits, even if they're only 70% better, and you tell them that, they're going to get really, really happy. So reevaluation report is a visit often to get skipped in an office. It's a really important visit. Make sure you're doing it. Make sure you go over it with them. And that key, again, we have the scripting, but are they where you expect them to be, better or worse than where you expect to be? And that's what they really do want to know. John, you're right where I expect to be after 12 visits. You're 75% better. 4 more weeks. We're going to cut you down twice a week, keep you at 3, whatever you're doing. And changing the, you don't have to change it at that point either. So some people, are 3 times a week for 6 weeks versus 4. If you're doing 6 weeks, 3 times a week, and that's 4 to reevaluate, you don't have to cut them back. So you're doing great. It's right where I expected. I want to keep you at 3 times a week for 2 more weeks. After that, we can drop you down to twice a week. So you don't necessarily have to change the treatment plan on a reeval visit as well. So don't forget, reevaluation reports are a really important visit that gets skipped a lot of times at chiropractic clinic. It's a really important visit, especially that 12 visit one. The first one is so key. If you miss the other ones, it's not great, but get that 12 visit one done. So hope this helps you out, and we'll talk to you all soon. For more information, go on our website, www.drjamesfedich.com.